Hello everyone, Jonathan Clavell from Clavell Urology here. So today I will answer 15 very common questions that most men have when considering a penile implant. My name is Dr. Jonathan Clavell and I am a urologist specialized in men's sexual health. I specialize in penile implant surgery and currently am one of the highest volume surgeons in the United States. If you're watching this, either you or someone you know has erectile dysfunction. You have heard or read about the penile implant and probably have a ton of questions about the procedure and the entire process. If that's the case, you clicked on the right video. Let's dig into what are 15 of the most common questions that I get from my patients. So this one is easy. If you have erectile dysfunction that is not responding to oral medications, you are a candidate. Unlike popular belief, the penile implant is not the last resort for the treatment of erectile dysfunction. Why? We know it is the best resort for the treatment of your ED once medications fail. According to the American Urological Association guidelines, once you fail pills, all options are available for you. And what are those options? The vacuum erection device, intracavernosal injection therapy, intraurethral therapy, and the penile prosthesis. Other options like PRP, stem cells, or shockwave are still considered experimental and not currently recommended. So you do not have to fail all other therapies prior to considering an implant. Once you have ED and have failed oral medications, you are a candidate for the penile implant. There's no age limit for the penile implant. There's no illness that would prevent you from getting one either. Diabetes, history of open heart surgery, prostate cancer survivor, renal transplant, it does not matter. If you have ED, you are a candidate. So currently there are two types of penile implants. The inflatable penile prosthesis, which gives the man the ability to keep his penis hard during sex and the penis soft when not having sex. In order for you to get your penis hard, you will need to squeeze a pump that's placed in your scrotum. Then there's the malleable or semi-rigid implants, which are usually reserved for guys who are not able to squeeze the pump to inflate the penile prosthesis. Most patients benefit from the inflatable penile prosthesis. It will give you the most natural look and feel as the penis will be fully rigid when inflated and flaccid when the implant is deflated. Now, as of 2022, there are two manufacturers or companies that make penile implants in the United States, and there's a third one coming along the way. They both have their characteristic features that make them unique in their field. I would say probably about 90% of men would be happy with either one. So which one is specifically right for you is a conversation you should have with your doctor. I personally use both manufacturers. After a full examination and assessment, I will be able to determine which type is best for you depending on your specific anatomy and personal preferences. My goal is to provide you with the most natural outcome possible so that both you and your partner are happy. In general, no. You should not lose length with the penile implant if being implanted by a high volume surgeon. The implant does not get your penis smaller. Erectile dysfunction and Peyronie's disease do. Even though there are some studies that mention that the penis is smaller after a penile implant, most high volume surgeons have certain tricks they can recommend prior to the surgery and during your surgery to maximize your size. Moreover, have you heard the term, if you don't use it, you lose it? Well, in a sense, that is kind of true. If you've had ED for a long time, that is, if you've had problems with getting blood flow into your penis for many years, the penis will not stretch as it used to, and this may cause your penis to decrease in size. So if you wonder, well, doc, when I was young, I didn't have sex every day and my penis didn't get smaller. Well, that might be true, but every night you had multiple erections while you slept. This is why it is important to have those erections at night or during the mornings. If you have nighttime erections, celebrate those. Erectile dysfunction can cause your penis to get smaller, which may limit the size of the implant that you're gonna get. Will the size be similar to what your penis was 10 or 15 years ago? We do not know. But one thing we as penile implant surgeons can assure is that as surgeons, we try to put in the biggest implant that your penis will tolerate. Now, some might wonder, what can I do if I've lost some size already? So one thing you could do is use a vacuum erection device. Use it regularly to stretch the penis, and sometimes you can recuperate some of your lost size. Even though you might think the implant will explode, it won't. This is not a balloon that will continue to stretch. This is a well-designed medical device by professional engineers that when it reaches a certain pressure, it cannot expand beyond that. This will not pop, this will not explode. There's no such thing as overinflating the implant. So rest assured, inflate that implant to the max because it will not break by you inflating it. Another thing to remember is that the implant will only be able to expand to what your penis allows it to. So if you've always had a thin penis, don't expect to have 6 inches of circumferential girth after the implant. This is like if you get a balloon to expand inside an American football. The balloon will only expand to whatever that football allows it to expand. It won't expand beyond that. So the inflatable penile prosthesis contains a reservoir that holds the fluid that will be inflating your penis to give you an erection. This reservoir is placed either in your pelvis or underneath your abdominal muscles. In most occasions, the reservoir is not palpable even if you have a flat stomach. You might feel it initially after it's placed, but you will likely stop feeling that after a couple of weeks after surgery. The fluid inside that reservoir is saline, the same thing we give you through an IV for hydration. If that fluid leaks out, your body will absorb it and you won't even notice it. So there is no need to worry. I am certain that your surgeon will do everything possible to get that reservoir in a space that you will not be able to feel it. The nerves that give you the sensation to your penis lie on the top part of your penis. I tend to make my incision below your penis and will be nowhere near those nerves. Even surgeons who place the implant from above via an infrapubic approach, they're able to spare those nerves without injury. The only thing that the implant will do is help your penis get hard. It should not affect sensation. It will not get blood flow to the head of your penis. That is a completely different mechanism. It should not affect your orgasm either. So rest assured, sensation should not be affected. This is a great question. Firmness is determined by your grip strength, to be honest. If you have a strong grip, you will be able to get it as strong as a rock. If that is too hard for your partner, you can always tailor it to about 80 or 90%. Basically, whatever feels comfortable for both you and your partner. Remember, with the implant, you have complete control of your erection. The penile implant is made out of silicone and your body will not reject it. You will not become allergic to it. You will not need medications to prevent rejection. It will not cause cancer in the future. Implants have been present for almost 50 years and have been proven to be safe. This is an implant, not a transplant. So no need to worry, your body will not reject the implant. You do not need to take steroids. You will be okay. But one of the major advantages of the penile implant is partner satisfaction. Why? Your partner will feel a natural and firm erection. The penile implant takes the shape of your penis. Therefore, your partner will feel, well, your penis, but firm. So most partners will not be able to tell the difference between a natural erection and an erection with a penile implant. The implant provides for something as close to a spontaneous erection as you will ever get. So no need to wait 30 minutes for the medication to kick in. You have complete control of your erection. Think of it this way. Every single time you or your partner wish to have sex, you will be able to. All of the components within the penile implant are concealed inside your body. That said, when the implant is placed, the implant will keep your penis on the stretched state. If you were a grower and not a shower, you will become a shower now after surgery. This might be something you will need to adjust to, but rest assured, most people will not be able to tell if you have something in there. You can be at the gym showering completely naked and no one will be able to tell that you have an implant. Your penis, however, will be soft when you want it soft and hard when you want it hard. The most common risk of this procedure is infection. However, that risk is very low when the surgery is performed by a skilled, high-volume surgeon. Even if you are at high risk for developing an infection, for example, if you have diabetes, have history of cancer, HIV, transplant patient, or any other medical condition that has compromised your immune system, you can still undergo the surgery with minimal risk. Other risks like erosion, necrosis, malposition are extremely rare in the hands of an experienced surgeon. The surgery in most locations takes less than 1 hour from the time you go to sleep to the time the surgeon is finished. Therefore, under regular circumstances, the surgery is considered outpatient. When I do the surgery, you will go home the same day of the procedure. You do not need a catheter to drain your urine. You do not need to come back to the office for a follow-up until 4 to 6 weeks after the procedure. However, this is something you must discuss with your surgeon. Believe it or not, I have never had to prescribe a narcotic for any of my patients. Most of the time, I am able to numb the area with a medication that will keep you almost free of pain for the first 3 to 5 days. Most patients do not complain of pain per se, but do mention that the first few weeks the implant is uncomfortable. That said, we will be with you throughout your entire recovery, helping you out. The medications we offer you will help control your pain at home without you having to worry. This one may be a little tricky because there are many factors that can influence your ability to go back to work. For example, what do you do for work? If your work is sedentary and does not require strenuous activity or heavy lifting, you can go to work as soon as a few days to a week, depending on your pain tolerance. If your work requires heavy lifting, I typically recommend for you to be on light duty for at least 4 to 6 weeks. You have a reservoir that will be placed through your groin and underneath your abdominal muscles, and we do not want that reservoir to herniate down into your scrotum. If you need us to fill out any paperwork for you to present at your job, we will be happy to fill that out for you. In general, no heavy lifting for 6 weeks. After those 6 weeks, you can do anything without restrictions. And if people ask you what kind of surgery you had, just tell them you had a hernia surgery. Unless you work in a urology office or are married to a urologist, no one will know you had a penile implant placed. We need to remember the penile implant is a medical device, and as with any other medical device, it can fail at some point. That said, studies show that most implants last more than 15 years. Why does it fail? The fluid within the system can leak out. If there's a break within the system, the fluid leaks and the implant will not inflate. How will I know it stopped working? Well, simple. One day you will be ready to inflate and you will notice that the pump does not work and stays flat. That is a sign of a leak. If it happens, call your surgeon and he or she will guide you and tell you what the next steps will be. Just remember one thing, even if it fails, there are many surgeons who are experts in revision surgeries and can get one back in there without major hesitation. Call us, we can help you. Now we have a bonus question. I have great news for you. Most major insurances cover the expenses of the surgery. If your insurance does not cover it, we will work with you to try to get you coverage. We are now able to provide you with financing options to help cover the cost if you have to pay out of pocket. Just call us and we'll explain everything to you. We look forward to meeting you in person. So this is it. I just answered the 16 most common questions related to penile implant surgery. If you enjoyed this video, remember to hit the like button below, consider subscribing to our YouTube channel, and share it with others. And if you have other questions, feel free to comment below, and I'll be more than happy to address those questions for you. Thank you, and see you next time.